Today on Real Pilates, we're going to talk about some abdominal layers that are super deep and in the bottom of the abs, called the pelvic floor. So if we think of the abs like a coffee can, there's a top, there's a bottom, there's a front, there's a back, and then there are the sides. So that pelvic container, the bottom of that is the pelvic floor. And on that pelvic floor, all of the organs of the body sit, except for the heart, which is hung on the ninth rib. And of course, the diaphragm is hung from the base of the heart. So the pelvic floor is super important to help you with things like incontinence, contracting, and holding your needs there, your urinary needs. Pelvic floor is also super critical for breathing. So every time you take a breath in, the diaphragm sucks downward so that the air can be filled into the lungs, and the diaphragm pushes up against the pelvic floor. Without really many people being aware, pelvic floor is very important for men as well, because pelvic floor helps with their erections. A lot of erectile dysfunction is caused by weak pelvic floor of men. It's not all blood flow. There is a series called the Rectus series, has nothing to do with erectile dysfunction, which is a series that runs from the tip of your jaw down the bottom, all the way past pelvic floor to your tailbone. As you know, we have those little extra spine bones that stick out called the coccyx or the tailbones. So every time you move your jaw, that last little vertebra does a little bit of movement and pelvic floor is stimulated. That is a series called the Rectus series. Pelvic floor is super important to keep tone and to keep strong. Pelvic floor that's too tight can cause problems of low back and knee and other things. Pelvic floor that is too loose can cause digestive organ problems, breathing problems, erectile dysfunction problems, as we discovered. You can strengthen your pelvic floor. Pilates does do that. But if you want to do additional exercises, you can do those contractions. So for a second, pretend that you have to tinkle and you want to squeeze and hold that tinkle. So that would be a direct pelvic floor movement. Or pretend that you have to pass gas, like ooh, and you're squeezing. So try to squeeze both of those at the same time and hold and then release. Hold and then release. In the beginning, you can do contractions that are a second or two long, and you can do like 3 sets of 10. As you get better, you want to do shorter, quicker contractions of pelvic floor, and you can blend those movements. You can do sets of longer ones that are 1 to 2 seconds, and then short, quick, little split second ones. Every time, let's say there's a red light, see if you can do 10 pelvic floor contractions, or every time you're waiting for an elevator. Nobody will know you'll be doing them in clandestine. This is Pilates Master Nikki, and I'll see you real soon for another layer of Real Pilates.